With all of the medical disasters happening in earthquake and storm-ravaged Haiti, it is very hard to believe that people in Haiti are dying of enlarged prostates, also referred to as BPH, benign prostatic hyperplasia, a condition that is easily treated here in the US. An enlarged prostate is very common in men aged 50 and older and is primarily a quality of life condition associated with progressive lower urinary tract symptoms. When symptoms are severe and untreated, they can lead to serious medical conditions such as kidney failure. Kidney failure requires dialysis, but in Haiti, there are no resources to offer dialysis to patients. Therefore, patients can actually die. This story is about Dr. Mitchell Humphreys, urologist with the Mayo Clinic in Arizona, who has taken part in a humanitarian effort in storm-ravaged Haiti to save the lives of those with enlarged prostates. The purpose of the mission is to offer these patients a definitive treatment, so they won't have to worry about BPH-related symptoms such as being unable to urinate and going to get dialysis. This definitive treatment is called HoLEP, or holmium laser enucleation of the prostate. And this is the first time in the world that HoLEP is being performed in a developing country such as Haiti.
So the whole purpose of this initiative of HoLEPs for Haiti 2013 is because there's men here that are dying from big prostates. In other words, when they try to urinate, the prostate blocks the flow of urine outside the bladder, so it backs up. That can cause the kidneys to fail, which requires dialysis. Because there's a limit of dialysis available, they don't have resources to that, so they actually die, which isn't the case in most westernized countries.
HoLEP is a minimally invasive surgery which requires no incisions and is suitable for prostates of any size. The benefit is that once the prostate is treated, there is no need to treat it again. It's a permanent fix, and therefore patients don't have to have another surgery later on. Dr. Humphreys is part of the St. Luke Foundation for Haiti, an organization founded by Father Leo Richard Frechette, MD, which provides education, medical care, and humanitarian outreach to over 150,000 Haitians in need each year. Luminous, the global leader in the field of minimally invasive clinical solutions for the surgical, ophthalmology, and aesthetic markets, is supporting the efforts of Dr. Humphreys and the St. Luke Foundation for Haiti to provide relief and prevent potentially life-threatening complications in patients with enlarged prostates, using the most powerful holmium laser available, its VersaPulse PowerSuite 100-watt laser.
What led me to take on this challenge of doing these procedures in Haiti is this is really the first time any undertaking of this size has been done in a developing country. To my knowledge, there's never been a HoLEP done in a developing country because of the logistical challenges. So we're taking a 21st century solution to an 18th century problem, or big prostates. What led me to take this on is I was contacted by Father Rick Frechette, who runs St. Luke's and all these, and he was telling me about the need of everything in Haiti. HoLEP, unique compared to other surgical procedures, is when you're doing a HoLEP, they have less risk of bleeding because you're using a laser, and so you can seal those blood vessels very well. You don't have to worry about any electrolyte abnormalities because unlike other procedures, we use normal saline. With other procedures, you use glycine or sorbitol, and the patient can absorb those other solutions, and that can lead to electrolyte problems. With this procedure, since it's all saline, it's what's normally in the blood vessels, so you don't have to worry about any absorptive symptoms. The other thing is they get very little irritative voiding symptoms afterwards, and they can get back to their normal activity in 7 to 10 days instead of 6 weeks. So men here that are working, they're busy, they have to take care of their families. After a 10-day recovery period, then they can get back to doing all their normal stuff. That's much better with the other therapies that may take up to 6 weeks.
This initiative is important to the mission of St. Luke's Hospital. The hospital provides treatments to those in need and helps the local community. The HoLEP treatments are given to men who are otherwise confined with catheters and can't work or take care of their families. After HoLEP, these men can get rid of their catheters and get back to their normal lives.
Our first case yesterday was a man that had had a catheter for 15 years, and after his surgery, today he walked home without a catheter, and he was able to urinate without a catheter 3 or 4 times this morning, so he's very excited.
Down here in Haiti, where there's a lack of resources, there's a lack of medications, there's a lack of physicians, there's a lack of urologists, these men get big prostates and they think that it's part of the normal aging process, but once they're unable to pee, that pressure and the toxins build up in the kidneys and their kidneys start to fail. And if you don't get the urine out, eventually the kidneys will die and they'll end up on dialysis. So now you've taken somebody that just can't pee, and now their kidneys are backed up and their kidneys are failing with no access to dialysis, means that they die. The most amazing part about this is the caring spirit of everybody that wants to do this. All they want to do is help these people in Haiti that are otherwise dying.